Now, why would management of the clenching, grinding, bruxism, parafunction, why would that be an anti-aging sort of treatment? Well, one of the signs and symptoms of parafunction or bruxism, I'm just going to call it bruxism for the sake of ease. So one of the side effects of bruxism, or one of the signs or symptoms, is that it does cause your teeth to wear down more quickly. And although there's the kind of phrase long in the tooth is actually due to gum recession. However, the teeth can still appear quite long, even though they're actually being worn down quite gradually. Now, we can do things to manage the actual wear of the teeth. However, if we don't do anything to treat the underlying cause, then all of that hard work is likely to come to harm fairly quickly. So, for example, one of the ways of managing wear of the teeth is placing composite build-ups, or you could have veneers or crowns depending on how severe the wear is. But if you're still clenching, grinding all night long, then more damage is going to occur, or the restorations are going to fail. So what is bruxism and why do people do it? So bruxism, bruxism is more the kind of clenching and grinding. Parafunction is basically any prolonged contact of the teeth that isn't related directly to function. So even things like, well, chewing your fingernails, that's a parafunction. Chewing gum is a parafunction. Chewing pen lids, anything where it's not actually functional, so you're not eating, then it is a parafunctional contact between the teeth. And they can all be quite harmful because really the teeth aren't actually meant to be in contact for that long during the day or in any 24 hours. So while you're asleep, they're not actually meant to be in contact. They should be apart. So why do we do it? Why do we clench and grind? There are so many reasons, and there are lots of different theories about managing them. Kind of dealing with occlusal interferences when you're biting together, that is one tool. But it is much better to look at the management of bruxism in a holistic approach and a holistic way, because there are often psychological causes, often associated with stress, anxiety. It can be associated with certain medical conditions or medication. Obviously, certain medications, you have to be on it, but if medication may help the underlying medical condition that's leading to the bruxism, then seeking medical treatment for that may be beneficial and reduce symptoms. And in some cases, in very severe cases where there is a lot of what we call atypical facial pain, then even having some medication prescribed to help with that can help to reduce the bruxism as well. So really, there is no easy answer as to why you do it. It could be for a number of reasons, and you may not even realise how or why you are clenching or grinding. To be honest, the vast majority of people aren't aware that they're doing it. And through conversations that I've had with people, even just bringing their attention to the fact that I think they might be, sometimes they come back and go, oh, you mentioned that I might be clenching or grinding my teeth. Well, since you said that, I've noticed that I am. And I'm doing it when I'm driving, or I'm doing it when I'm concentrating, or whatever it is, but they're aware of doing it during the day. And often people who are doing it during the day, often but not always, often they are also doing it when they are asleep. And people say, oh, my husband never complains that I'm clenching or grinding. Well, number one, they're asleep, so they're not going to hear you anyway. It's not like you're snoring and sucking in the curtains. Number two, it doesn't always create a sound. So they may not even be aware that you're doing it because there's no sound being generated. So the vast majority of people who clench or grind do not know that they're doing it. the only real way that you may know that you're doing it is if you start getting signs and symptoms of it. So kind of tenderness or tension in the facial muscles or jaw pain can all be associated with bruxism. So that might be how you notice it. More commonly, it's often your dentist who says to you, have you been clenching or grinding? And what can we do about it? Like I say, it's often a holistic approach. It's not just a case of here's a treatment, off you go, you're fixed forever. And usually it's a case of managing the symptoms rather than being able to address all of the underlying causes, because more often than not there is no single cause for it. If we can get to the root of the problem and find out what's going on, then that can help in the management of it. But often we look at what's going on and how clenching and grinding is going on. First step, or the first port of call, is often an appliance to wear at night. If you're aware of doing it during the day, it's kind of trying to train yourself not to do it. However, if you're in situations where you're just not able to stop yourself, there are appliances that you can wear during the day to help with that. I have a TMJ specialist physiotherapist local to me that I can refer to, so physiotherapy can be very helpful. And I also actually have quite a number of patients who have conditions such as joint hypermobility. Now, joint hypermobility of the jaw joint combined with clenching or grinding is a tricky combination, and providing some sort of appliance that can help with the stability of the jaw joint as well as managing the clenching and grinding can be helpful. Combined with physiotherapy is a really potent way of dealing with that particular combination of problems. But I have lots of tools in my box for managing clenching and grinding. Now, one of those treatments is to reduce the strength of the contraction of the muscle here, and we can do that with a prescription medication. But that's never my first port of call, never. It's often in conjunction with other treatments, and because those other treatments can often reduce the symptoms enough, manage the problem enough, that we don't need to go down that route. So really, again, no easy answer of how to manage. So there's no easy answer as to why people do it, because there's no one size fits all. There's different reasons for different people, and there's no easy answer for how to treat it other than saying a combination approach. It is more than one treatment modality to get the best sort of result, but using all of these different tools can be very successful and can make a huge difference to quality of life, because the pain and loss of function associated with clenching and grinding and the facial muscles, you know, it's not just here. You can end up with headaches, migraines, neck pain, shoulder pain, because when we clench, it's not, you know, it's not, you can see all of the muscles, and that you can tell I'm a clencher. But it's all of these muscles that are involved in it as well. So you can end up with lots of symptoms due to clenching and grinding, not just kind of facial pain. So there is that knock-on impact with quality of life. So if you are a clencher or grinder, then I would urge you to find yourself a dentist who is adept in managing the condition, is able to give you a full assessment of the jaw joint and the associated musculature and your individual problem, and come up with a treatment plan uniquely for you and managing your condition.